Breastfeeding a newborn is a crucial aspect of early infant care, providing numerous health benefits for both the baby and the mother. In this video, we will explore all aspects of breastfeeding, including its importance, benefits, techniques, challenges, and tips for success. Introduction to breastfeeding. Breastfeeding is the natural process of feeding a newborn baby with breast milk, produced by the mother's mammary glands. It is widely regarded as the optimal method of infant feeding, offering a unique combination of nutrients, antibodies, and bioactive factors that promote optimal growth and development. Breast milk is specifically tailored to meet the nutritional needs of the infant, providing the perfect balance of proteins, carbohydrates, fats, vitamins, and minerals. Importance of breastfeeding. Breastfeeding is not only beneficial for the baby's health, but also for the mother's well-being. For the baby, breast milk provides essential nutrients and antibodies that protect against infections, allergies, and chronic diseases. Breastfeeding is associated with lower rates of childhood obesity, respiratory infections, gastrointestinal illnesses, and sudden infant death syndrome, SIDS. For the mother, breastfeeding promotes faster postpartum recovery, helps prevent postpartum depression, and reduces the risk of certain cancers, such as breast and ovarian cancer. Benefits of breastfeeding for the baby. Breastfeeding offers numerous benefits for the baby's health and development, including nutritional benefits. Breast milk contains all the nutrients necessary for healthy growth and development, including proteins, carbohydrates, fats, vitamins, and minerals. Immunological benefits. Breast milk is rich in antibodies, immune cells, and other bioactive factors that protect against infections and boost the baby's immune system. Digestive benefits. Breast milk is easily digestible and helps prevent gastrointestinal issues such as constipation, diarrhea, and colic. Cognitive benefits. Breastfeeding is associated with improved cognitive development and higher IQ scores in children. Emotional benefits. Breastfeeding promotes bonding between the mother and baby, fostering a strong emotional connection and sense of security. Benefits of breastfeeding for the mother. Breastfeeding also offers numerous benefits for the mother's health and well-being, including faster postpartum recovery. Breastfeeding stimulates uterine contractions, helping the uterus return to its pre-pregnancy size more quickly. Weight loss. Breastfeeding burns calories and helps mothers lose pregnancy weight more effectively. Hormonal balance. Breastfeeding promotes the release of hormones such as oxytocin and prolactin, which help reduce stress and promote feelings of relaxation and well-being. Reduced risk of certain diseases. Breastfeeding is associated with a lower risk of breast cancer, ovarian cancer, type 2 diabetes, and cardiovascular disease in mothers. Cost savings. Breastfeeding is cost-effective compared to formula feeding, as breast milk is free and readily available. Techniques of breastfeeding. Proper breastfeeding technique is essential for ensuring a successful and enjoyable breastfeeding experience for both the mother and baby. Some key techniques for successful breastfeeding include latching. Ensuring a deep latch is crucial for effective milk transfer and preventing nipple pain or damage. The baby's mouth should cover both the nipple and a significant portion of the areola. Positioning. Finding a comfortable breastfeeding position is essential for both the mother and baby. Common breastfeeding positions include the cradle hold, football hold, cross cradle hold, and side lying position. Frequency. Newborns typically need to breastfeed frequently, often every 2-3 hours or 8-12 times per day. Following the baby's hunger cues and feeding on demand is recommended. Emptying the breast. Encouraging the baby to feed from both breasts during each feeding session helps ensure adequate milk supply and prevents engorgement. Burping. Burping the baby frequently during and after feedings helps release trapped air and reduces the risk of colic or reflux. Challenges of breastfeeding. While breastfeeding is a natural and instinctive process, it can also present challenges for some mothers and babies. Common challenges of breastfeeding include nipple pain or damage. Improper latch or positioning can lead to nipple pain, soreness, or cracking. Engorgement. Overfull breasts can become engorged and painful, making it difficult for the baby to latch properly. Low milk supply. Some mothers may experience challenges with milk production, leading to concerns about inadequate milk supply. Breastfeeding difficulties. Premature birth, tongue tie, or other medical issues can affect the baby's ability to breastfeed effectively. Mastitis. Mastitis is an infection of the breast tissue that can cause pain, swelling, and flu-like symptoms in breastfeeding mothers. Tips for successful breastfeeding. Despite the challenges, many mothers find breastfeeding to be a rewarding and fulfilling experience. Some tips for successful breastfeeding include: seek support. Reach out to a lactation consultant, breastfeeding counselor, or support group for guidance and encouragement. Stay hydrated and nourished. Drink plenty of fluids and eat a well-balanced diet to support milk production and overall health. Rest and relaxation. Get plenty of rest and practice relaxation techniques such as deep breathing or mindfulness to reduce stress and promote milk letdown. Skin-to-skin contact. Spend time holding your baby skin to skin, which can help promote bonding and stimulate milk production. Trust your instincts. Trust your body's ability to breastfeed and listen to your baby's cues. Every breastfeeding journey is unique, and it's essential to find what works best for you and your baby. While breastfeeding is a natural process, it can present challenges for some mothers and babies. It's essential to recognize these challenges and seek support when needed. Some common breastfeeding challenges include nipple pain or damage. Nipple pain or soreness is common, especially in the early days of breastfeeding. This can be due to improper latch or positioning. Using lanolin cream, warm compresses, and adjusting the baby's latch can help alleviate discomfort. Engorgement. Engorgement occurs when the breasts become overly full and swollen with milk. This can make it difficult for the baby to latch properly. Applying cold packs or cabbage leaves to the breasts, massaging them gently, and expressing milk can provide relief. Low milk supply. Some mothers may worry about having a low milk supply, particularly if the baby seems fussy or not satisfied after feedings. Ensuring frequent and effective breastfeeding, staying hydrated, and practicing relaxation techniques can help boost milk production. Breastfeeding difficulties. Premature birth, tongue tie, or other medical issues can affect the baby's ability to breastfeed effectively. Working with a lactation consultant or pediatrician to address these issues and develop a feeding plan can help overcome breastfeeding difficulties. Mastitis. Mastitis is an infection of the breast tissue that can cause pain, swelling, and flu-like symptoms. It often occurs when milk ducts become blocked or due to bacteria entering the breast tissue. Rest, warm compresses, and antibiotics are typically used to treat mastitis. Benefits of breastfeeding for the mother. Breastfeeding offers numerous benefits for the mother's physical and emotional health. Some of these benefits include faster postpartum recovery. Breastfeeding stimulates the release of hormones that help the uterus return to its pre-pregnancy size more quickly, reducing postpartum bleeding and discomfort. Weight loss. Breastfeeding burns calories, helping mothers shed pregnancy weight more effectively. It also contracts the uterus, leading to a slimmer appearance. Hormonal balance. Breastfeeding promotes the release of oxytocin, known as the love hormone, which helps reduce stress and promotes feelings of relaxation and well-being. Reduced risk of certain diseases. Breastfeeding is associated with a lower risk of breast cancer, ovarian cancer, type 2 diabetes, and cardiovascular disease in mothers. The longer a woman breastfeeds, the greater the protective effect, bonding, and emotional well-being. Breastfeeding fosters a strong emotional bond between mother and baby, promoting feelings of closeness, security, and satisfaction. The physical closeness and skin-to-skin contact during breastfeeding release feel-good hormones that promote maternal-infant attachment. Breastfeeding tips for success. Successful breastfeeding requires patience, practice, and support. Here are some tips to help you succeed. Educate yourself. Learn as much as you can about breastfeeding before your baby arrives. Take a breastfeeding class, read books, and seek advice from experienced mothers or lactation consultants. Start early. Begin breastfeeding as soon as possible after birth to take advantage of the baby's natural instinct to suckle and latch onto the breast. Seek support. Don't hesitate to reach out for help if you're struggling with breastfeeding. Lactation consultants, breastfeeding support groups, and online forums can provide valuable guidance and encouragement. Stay hydrated and nourished. Drink plenty of fluids throughout the day and eat a well-balanced diet rich in fruits, vegetables, lean proteins, and whole grains to support milk production and overall health. Practice skin-to-skin contact. Spend time holding your baby skin to skin, especially in the early days and weeks after birth. Skin-to-skin contact helps regulate the baby's body temperature, promotes breastfeeding, and strengthens the parent-child bond. Follow baby's cues. Breastfeed your baby whenever they show signs of hunger, such as rooting, sucking on fists, or making sucking noises. Responding promptly to your baby's cues helps establish a healthy breastfeeding relationship and ensures they get enough milk. Take care of yourself. Remember to prioritize self-care and rest whenever possible. Get plenty of sleep, accept help from others, and don't be afraid to ask for assistance when needed. In conclusion, breastfeeding a newborn is a deeply rewarding experience that provides numerous benefits for both the baby and the mother. While it may present challenges along the way, with patience, persistence, and support, many mothers find breastfeeding to be a fulfilling journey that strengthens the bond between parent and child. By prioritizing breastfeeding education, support services, and creating a supportive environment for breastfeeding mothers, we can help ensure the health and well-being of infants and mothers worldwide. Thank you for watching. Please subscribe, like, and share.